Hi, my name is Dr. Allison Sigal. I'm a specialist in pediatric dentistry, and I am the founder, owner, and researcher at Little Bird Pediatric Dentistry. My practice is completely dedicated to the provision of airway-centric care, which includes tongue and upper lip tie assessment and treatment, myofunctional therapy, and buccal-nasal breathing. Our goal is to help children from birth onwards breathe, eat, sleep, grow, and live better. Every day we care for families that wish they knew more about tongue ties, which inspired me to create this top 10 video. For you to be your own advocate, share with your friends, loved ones, and patients to help make this information become common knowledge. Here we go. What would I say are the top 10 reasons why we should release a tongue tie and allow for optimized tongue function? Well, after caring for over 3,000 patients of all ages, from babies, children, to adults, following my specific airway-centric protocols and surgical techniques, this is what we know. Number 1. We as humans are designed to have optimal tongue rest posture. It's in our anatomy. The tongue is a suction cup, known as a muscular hydrostat. The hard palate, roof of your mouth, is comprised of valleys and ridges to allow space for the full free tongue to naturally suction up against the hard palate at rest. 24/7 when not talking or eating, this is where your tongue is meant to be. Number 2, regular nose breathing. With your tongue suctioned up fully, we can only nasal breathe. As human beings, we are designed to do. The air is therefore filtered, warmed, and humidified, and nitric oxide is incorporated from the nasal sinuses, allowing nearly double the volume of air to reach the middle and lower lobes of our lungs. Less work for your cardiovascular system, and you are less likely to have enlargement of your tonsils and adenoids or respiratory infections because of this invaluable nasal filtration. Number 3. Growth and development. With the tongue suctioned up, applying constant pressure to the roof of your mouth, the palate, it will shape it to be wide, flat, and allowing optimal development of our nasal airways, which is the flip side of our palates. Also allows for optimal development of our dental arches for future tooth eruption, and allows for the lower jaw to develop wide and forward, which further optimizes the upper airway and overall development of our face, known as cranial facial growth and development. Number 4, quality sleep. Only with the tongue fully suctioned to the roof of your mouth can you achieve a level of deep quality recuperative sleep, as the tongue suctioned is unable to fall back and compromise the airway, which if this takes place through micro and macro arousals, the body drives the individual into lighter phases of sleep. Tongue ties are amongst the top predictors for sleep disordered breathing, which is defined as sleeping with your mouth open, mouth breathing, with or without snoring or noisy breathing, and sleep apnea in your lifetime. All things we want to avoid if possible. Number 5, your parasympathetic rest and calm nervous system activation and stimulation. The roof of the mouth is innervated by parasympathetic cranial nerves, which are triggered to activate by the pressure of the tongue, as does nasal breathing. Specifically when you exhale through the nose, it triggers the parasympathetic nervous system, which allows patients to feel a sense of calm, rest, reduced heart rate and blood pressure, aids in your digestion, and allows for reduction of anxious tendencies or feelings. Versus when your tongue is down or your mouth breathing, specifically when you exhale through your mouth, it triggers the opposite, which is the fight and flight sympathetic nervous system. That's going to increase your heart rate and blood pressure, your cardiovascular demands, anxiousness, and irritable feelings. Number 6, mood and behavior. Patients with optimal tongue rest posture and function nasal breathe better, sleep better, and have more parasympathetic activity stimulation. Therefore, they feel and act better with less emotional regulation challenges, a greater sense of calm, patience, focus, and concentration. They feel happier and less irritable and frustrated, with more energy to give positively throughout the day. Number 7, improve eating, drinking, overall swallowing function. Having full function of your tongue allows the front third of the tongue to work via compression, stiff as a board, and then the back 2/3 to have that wave-like peristaltic movement that slows and controls your swallow. Full movement of your tongue aids in moving food around with ease to properly chew, form a bolus of food to then swallow. You're less likely to be a picky eater, gag, choke, or vomit when eating or drinking, and more enjoyment or pleasure with eating, and ease of swallowing pills. Number 8, speech, articulation, and ease. With full function movement of your tongue, it allows ease of tongue movement to learn and master speech sounds, especially sounds requiring vertical lift of your tongue, like L or N, for example. We see improvements in mumbling, articulation, clarity, and for older patients reporting that it's easier and more comfortable to speak, taking less energy or concentration, as their tongues can finally keep up with their minds. Number 9, posture and body range of motion. Only with your tongue optimally resting up against your palate can your head be aligned with your shoulders, aiding in proper posture, which will allow freedom of your neck and shoulder range of motion. And because all fascia that connects your body from head to toe begins with the tongue, it can impact the range of motion of your entire body, including your toe touch distance. Every patient with a tongue tie will have suboptimal forward head posture, as the tongue is anchored towards their neck. And every inch that your earlobe is ahead of the middle of your shoulder will add 10 pounds of weight to your neck or cervical spine. And that is a lot. Number 10, reduction of headaches and migraines. Now, although multifactorial, we know that if due to improper tongue rest posture, you're not getting enough quality sleep, and you're holding your head in a forward suboptimal posture with excess muscular strain of your neck and upper back, you are more likely to have sore eyes, headaches, and or migraines. Tongue tie release may improve or completely resolve these symptoms once you have attained optimal tongue rest posture and function. I encourage you to use this QR code on our website to download, view, and share our age-specific self-assessment checklists of airway compromise across all ages. These checklists are incredibly accurate in predicting patient needs and those who would benefit from airway-centric care. If you're answering yes to many items, it is worth seeking a consultation with a healthcare provider. To wrap up our top 10 video, when I am asked if I would recommend a tongue tie release, if a patient presents with a tongue tie and they are symptomatic, the answer in one word is yes. Achieving optimized tongue rest posture and function should be a universally practiced and provided service. This, in fact, is my career goal, as every person deserves to live their best optimized airway-centric life. Thank you for watching this video, and please share this information with your family, friends, patients, and communities. We are stronger together, and let's make this information become common knowledge.